That's okay.
There's something going on with the camera on this computer.
Yeah, Paul. Okay, I'm gonna send him another.
So I got this Hangouts app on my phone, and it's nice because then I can talk to students on Hangouts when I'm not at home. But I haven't figured out how to hang up.
Oh, no.
So every time I'm done, I'm like struggling to get the phone turned off entirely, and the student continue talking, and I'm like struggling. I'm like, don't say anything. I'm not supposed to hear yet. Wait. If I turn off the app, it doesn't. It just keeps going.
Oh, that's interesting.
But now I'm on the computer. I know how to turn off. I'm okay with a Hangout on the computer. Except my camera's not working.
I didn't hear back from Paul.
Yeah, he said he's getting like, please wait. So I'm sending him another invite.
Okay.
Yeah, that's the notice I saw. It was something from Paul.
Mm-hmm.
I turned my phone back on, and it's showing there, even though I'm not supposed to be on over there. Oh, there he is. Is that him?
Finally made it in on my 5th
Oh,
PM.
All right.
Okay. Mm-hmm.
So are we live?
Okay. So you guys can go ahead and start. You are breaking up a lot, so I don't know how much I'll say, but since I talked to Dr. Baker on Friday, so maybe I won't chime in a lot because you guys are breaking up on my end. But we can go ahead and start because the podcast is on.
okay. And this is Willow team, so this is the whole team, right?
Yeah.
Yes.
The three of us.
You know, I apologize to Andreen on the phone. I wanted to apologize to you guys. I mean, a group of 3 has some advantages, but I would have made you a group of 4. I didn't realize that Christina was gone.
Oh.
She didn't drop the course.
Oh, she didn't.
Oh.
No. She's, you know, and I'm not going to tell you anything more about her than that, other than that's why I didn't know she was gone.
Oh, no.
Oh.
So I would have given you a 4th person, mainly really for the 5-person teams more than for your team, because I think 5 people is harder than 3.
I would probably be there. Yeah.
Yeah. I mean, the logistics get more and more difficult to get 5 people together. I think getting people together is harder than having fewer people to do the work.
Mm-hmm.
But 3 is fine for this assignment.
Mm-hmm.
But I still would have given you 4. I think 4 is better.
Mm-hmm.
But I didn't know until people had already started working on the 4th assignment. I mean, I wouldn't have known for the policy packet, but I could have done it for the social justice analysis.
Okay.
But I think sometimes a smaller group, it gives you a tighter presentation.
Yeah, I thought it was fine the last assignment.
Yeah.
I think we do well. I think we'll do good with this one too.
Yeah.
Yeah, I tend to agree. I think that we have a little more control over the work that gets done when we're in a smaller group.
Mm-hmm.
Yeah. Yeah, I think it can be. I mean, if you have slackers, you want a bigger group. But if you have a good group, a smaller group works better. It's just tighter. You know, you get together, you talk, you figure things out, and then it's better.
Mm-hmm.
It's definitely better logistically.
Yes.
Anyway.
Yes.
But you know, neither here nor there. I would have given you a 4th person, and I didn't know that you didn't have a 4th person. When I didn't know that Christina was dropping out until I saw that there were only 3 people on your submission.
Wow. Okay. So I guess we should just go ahead and start discussing probably right at the beginning with the analysis, or was there something else anyone wanted to discuss before we do that?
Well, I wanted to ask, I know Andreen asked if one person should present, but are we still going with the original plan of we're all three going to present our slides? Do we have that plan?
Did you address the question to me, Mindy? Because I didn't hear anything you just said.
Oh, sorry. Did anybody else hear me?
I heard you.
Okay, so one person can present. However, when we met last time, we agreed that we would each present our own slides. So is that
okay? You can do it either way.
Okay.
One of you should moderate. That just means that I'll post the slides and then I'll make that person a moderator, and then they just push a little button at the bottom that advances the slides.
Sure. Okay.
And then everybody gets their picture up all at once and gets all ready. And then all you have to do is mute and unmute yourself. It makes it much simpler.
Okay.
So I don't know if you could, I don't think, can you guys hear me except for Dr. Baker?
Yes, I can hear you.
Oh, okay. So did you hear what I said, Paul? So we're gonna present our own slides, correct?
Yes.
Okay.
Yes, that's my impression. And since I am the first person speaking, I'll be happy to moderate.
Okay. Sounds good.
Okay. So and then when you look at the recordings, they look really good when you see the whole team up there. They look better actually than the original, the way it records.
Okay, good.
Okay.
You do have to repeat the questions though, because no, I take that back. I was going to say the chat box doesn't show, but the chat box does show, so it doesn't matter so much.
Okay. All right. So then for the analysis, Paul, you're right there.
Yeah.
Did you find a theory that would work for your chart?
Well, that's what I was going to go into now. Do you want me to kind of summarize all the theories, or just go with the one that I felt would represent probably the social justice issue the best?
I think just go with the one you think would be the best.
Okay. All right. Because it's a pretty lengthy section.
Right.
And some of them I had to reread a couple of times because she would spin into telling her own stories. And then by the time you reach the end, you're like, well, now what exactly was she saying here? But to me, the one that seemed to fit the best was the social or moral justice from a caring science cosmology. That one basically explores the concept that we're all interconnected, and that because of that view, we have to acknowledge that one person's humanity reflects on all humanity. And that we can't deny that we all depend on each other for survival. As a result, through that line of reasoning, it brings us to essentially where our nursing code of ethics come from and the pursuit of human rights. It's pretty short, but really basically it points out that we have a responsibility as nurses to help those who are in need, because it raises all of humanity. Do you feel like that's pretty representative of where we're wanting to go?
I think so, because I mean, we're talking about suicide in Oregon. So,
Right.
You know, it's completely out of control. It's worse than, you know, most states in the nation. So, but we're talking about what we want to do is awareness or like prevention for this. And we wanted to do it at a younger age. So as far as the population goes, should we do youth or to be more specific? And then maybe that's where the social justice is in youth for this clinical issue.
Are you asking me?
Oh no, I was.
Okay.
Yes.
I don't know. You look like you were looking at a particular person, but I wasn't sure who it was.
Nope. Ideas are welcome across the board.
Okay.
So I was thinking we should just narrow it down. I didn't know if, you know, since we were talking about public school programs of, you know, prevention, and I had a couple other ideas for solutions also that had to do with youth. So I don't know if we wanted to narrow it down to, you know, that population.
Well, I think that that's probably a good endpoint. At least my impression is that we would probably start out somewhat wide in talking about suicide in general and how that in itself is a social justice issue because of lack of services, lack of prevention, etc. And then we could narrow it down to a specific population to give us a focal point.
Okay.
Do you feel that that's pretty accurate, or the direction you'd like us to go?
You can do that, yeah. I mean, you can have it be about suicide in general and have it be a social justice issue. And your policy solution doesn't have to answer every question. It just has to help in some way. So your policy solution could be just youth, even if your whole presentation is not just youth.
Okay.
You could talk about people who are depressed and commit suicide as a vulnerable population, and you can talk about youth as a vulnerable population. Either way, you've got a social justice issue on both counts.
Mm-hmm.
So you can present it as youth from the beginning, but you don't have to. In order to kind of do the analysis for this class, you don't have to.
Okay.
So I think that's good then, Paul. Then, yeah, we'll just do suicide in general, and then for the solution,
Gee.
we can throw youth in
Are
there.
you guys still there?
Yes.
Yeah. Poor Andreens in cyberspace hell.
Okay.
Great.
So then I guess that kind of answers your section there.
Yes.
So let's back up a little though. With your section, Paul, so you're going to describe that population, the mental health issue.
Yes.
And call it a vulnerable population and use the A-Day model.
Yes.
Okay. And then you're going to use that chapter as your support. So then you have to explain how they fit into that A-Day model. You're going to do that?
Yes.
Okay. That sounds good. I just have to throw in that author was my dean when I was a student.
Oh.
Yeah. It wasn't dean very long. She's not dean material. She's not very good at details.
I really enjoyed a lot of the reading. I just found that sometimes the writing was so almost flowery that it was easy to get lost and have to restart.
Especially that first section, huh?
Yes. And it just may be that after all of these years doing scientific writing,
right,
that I've kind of changed my mindset when I read, and I want something like very concise and to the point. Yep. But then again, I don't know how you'd make a book if you tried to be concise.
No, you're right. It's a different kind of writing. It's definitely theory and philosophy, and it takes a while to make those points. Whereas with clinical writing, the shorter the better.
Right.
Making points. Nobody's arguing about whether the pathophysiology has changed or not.
Correct.
Right.
I do, if no one's gotten a chance, really recommend, and I wanted to figure out how to make it fit with our social justice issue, the chapter on compassion, biopower, and nursing. I found that very, very interesting, and it's something that I could probably see myself sinking my teeth into later and looking at how we can get kind of lost in the details and lose some of our compassion. But it's worth reading if you guys are.
Okay.
Are you a mental health MP, Paul?
Huh?
Are you mental health MP, Paul?
No, I'm not, but I have a strong background in mental health.
Because that chapter really appeals to people who are interested in the mental health issues.
Yes. And had I known that you could directly enroll in the mental health, I probably would have done that instead of family, just because I have a pre-existing degree in psych and all of that, and slowly found myself wandering into nursing over the years. So it probably would have been a better marriage of my experiences. But I didn't know until I was done.
A lot of people do the postgraduate certificate, and it's very new to be able to do that. So it might not have been the case when you started.
And it very well could have been. And I may end up going down there, but I've got to get the doctorate first.
Yeah. No, a lot of people, midwives and FNPs and women's health NPs, a lot of them decide they want to do psych too, because there's a need in their clinical agency.
Oh yeah, definitely.
In fact, one of our faculty is doing that right now. One of our midwife faculty is doing mental health, and she wants to do mental health for pregnancy, women who are pregnant.
Oh, that'd be interesting.
So yeah, that works really well, that chapter that you picked. But the one that you mentioned is one that people use a lot when looking at mental health.
I could see why.
Yeah. So if you're using that vulnerability model and you're using those 3 boxes of social status and human capital and social networks, and this explains part of the reason we have these outcomes, then who's doing the epi? Because the epi has to support you in all those assertions. Is that you, or is that Andreen?
I think that is Andreen who's doing the epidemiological part.
Did you hear me, Andreen, when I asked? She's still in cyberspace hell, isn't she?
Yeah, I think so.
I'm hearing you guys, but you're breaking up, so I cannot follow.
That's what we were thinking. So at some point, you need to make sure you're on the same page with Paul so that your epi, me saying it louder isn't going to help, is it? So that your epi needs to follow what he says about this being a vulnerable population.
Okay, what did you say about the epi, Dr. Baker?
Is there a place for me to put it in the chat box? There it is, yes. I'm going to put it in the chat box.
Okay. So, okay. I think I got what population did we pick? Because I know.
We're going to.
Okay. All right. That's fine.
Okay.
I think we talked about this.
Right. Yeah, because that's what I told Dr. Baker on Friday. I think we should just focus on mental health versus saying youth or the LBGT. I think we should just say mental health in general. So that's what we're going with?
Yes.
Okay. Yeah, that's good.
There is no.
Okay. That's fine. I got it.
Okay. Yeah, she and I have talked a little bit, but I can't remember if we talked about a day model. So as you guys work on this, the epi needs to say, mental health in the social status box, that people are stigmatized and can't get. I think we did talk about that, she and I. They can't get help because they're afraid to tell people, and people are afraid to ask. Are you thinking of suicide? There's that stigma. You'll ask people, about, you'll check their sugar, but you won't ask them, are they thinking of suicide? Not you personally.
Right.
The generic you. So there's that. And then when you get sick, when you get mental illness, you lose your insurance because you lost your job.
Yeah.
You lose your housing. You lose all that human capital that you need to stay well. So those things need to show in the epi, that this population has fewer of those resources because of their diagnosis. So they not only have the illness, but they have the social vulnerability that comes from the illness in addition to the physical vulnerability. Yeah, I mean, you can't really say that because somebody has diabetes, they are therefore part of a vulnerable population beyond physical vulnerability. They don't have an added social vulnerability, but you can say that for mental health.
Yes.
There's an added social vulnerability, and the epi needs to reflect that. Okay, so then we're going to solutions.
That's me, Mindy.
Okay, so what solution are you picking?
Well, we were going to do prevention.
Oh, right, you guys were going to do, prevention. You were going to do a toolkit, was it?
I'm sorry?
Is that you? Were you going to do a toolkit?
No, I don't think we talked about a toolkit. But
Good. Okay.
Prevention, and we were going to, because, suicide starts at an early age.
Oh, it was a youth program. It was a youth program. That's what it was.
So we were thinking about a youth program.
And it was requiring it in the schools, correct?
Right. So you guys are public schools.
Okay. So as you look at it, you need to come up with both evidence and theory for why this should work to prevent suicide among youth. So the theory, you're using the day model. Well, you don't have to use the day model. You've already used that to explain that they're a vulnerable population. What theory would say why this would work? Why this would work, both to prevent suicide and specifically to prevent it among youth, because you're defining. No, not specifically among youth, because you're not defining youth as a vulnerable population. Right. Sorry. And you want to follow a straight line of thought, which I'm not doing.
So I haven't come up with a theory yet. I just read one chapter in the book because we split up the reading, and I don't really think it pertained to prevention.
Yeah, the book is not great on solutions theories. The module is better.
Okay, so I'll look in the module.
That's why I put those in the module, because I felt like the book wasn't so good.
Okay.
The book is better at explaining why something is a social justice problem than it is for explaining why a solution would work.
Okay. You know, I also thought about
this solution is a very structural solution.
I'm
it's a structural solution, as many social justice solutions are. You're trying to get something in the school so that all the kids have it. So there's two models there in the module that will work for you.
Okay.
One is the trajectory of health inequities, and the other is the multi-level model, which are basically the same model, but it divides up those social determinants of health differently. You're saying it's making sense to you?
Yes, it is.
Okay, I'll stop then.
Makes sense. Yes. Another solution that I thought about was, it also had to do with youth, but how we're taking, extracurricular activities out of school, like PE, sports, that sort of thing. And I feel like those, if there's evidence out there, which I'm thinking there is, but how that relates to mental health for children. So we're taking all that away, and
oh, I love that.
About putting that back in to provide healthier.
So does putting PE in the schools reduce depression and suicide? I wonder if there's evidence for that.
I don't know. I thought about that.
That's a great idea. Okay. I love that.
Okay, I'll look for that then.
I have to just say that when my son's 24 now, but when he was in middle school, they had 1 semester of required PE in 2 years.
Wow.
And no after-school sports. I was stunned.
Yeah.
And this is a fairly wealthy school district.
Right.
I mean, really wealthy compared to some places, but
So I went to, with the extracurricular activities like sports, we know exercise prevents depression, so that's exercise.
Yeah.
So yeah, I think there is.
Well, and there's definitely evidence out there that when you increase PE at school, kids do get more exercise, which duh, but it does make a difference.
Okay.
So you could draw the line that way.
Okay. So how many solutions?
You only have to show one.
Okay.
You can show more than one if you want, but you only have to show one, because what I'm really looking for is for you to be able to kind of go through the process of thinking it through. Okay, why is it a social justice issue? What data would help me make that argument? What solution? And kind of just work through the process. So you only have to have one.
Okay. Sounds good.
But people sometimes have more than one solution, and they have all the data at hand and everything kind of ready to go, and they like to put up more than one. So you can if you want.
Okay. So for the second part, the winners and losers, so like who gains and who loses from the problem. So it would be like society, taxpayers, that sort of.
Right. Right. Of course, the families themselves, but then and often you can say we do as providers gain from the problem, but we don't gain a lot from suicide because it's not a long-standing issue. I mean, we don't do a lot of care.
Right.
Depression we gain because we treat depression, but not so much for suicide.
Sure. Okay.
We don't like to think of that we make our money off of other people's illnesses, but we do because of the way the system is set up. It would be much nicer to get paid for keeping people healthy.
It would.
Yes.
That's for sure.
So when you're doing that, the winners and losers for the problem, and then really just the losers for the solution, because the winners are the people who were losing in the problem. In the solution, whoever wins for the solution are the ones that were losing from the problem, right?
Right.
But it's not always the case. I mean, who pays for the solution might be some new player that you hadn't thought of.